time the Peoria County Health Committee meeting will start. And at this time, I need a motion to allow participants of Linda Daly and Rachel Relaford. And I saw the other hand over there. Thanks, Rob. Okay. All those in favor?
Aye.
Thank you. All right. I now have approval of minutes. I need a motion to approve the minutes for January 4th. Thank you, Phil. And a second, Jennifer. Thank you. Okay.
Ask for any corrections.
Are there any corrections?
So if you didn't see any, all those in favor?
So I don't see any hands, so all those in favor, say aye.
Aye.
Thank you.
Aye.
Oh, yes. And
And then those
Rachel, I didn't hear Rachel.
Aye.
Thank you, Rachel.
and those opposed?
And those opposed? Thank you.
Motion carries.
Motion is carried. Thank you. All right, let us move on to the informational items, and we'll start with the Board of Health. Monica Henderson.
Hello.
Hello.
So regarding the Board of Health and just a couple of updates, one thing I did pass out to all of the board members and have copies for the board members that are not in attendance is our annual report. By state statute, your local boards of health have to submit within 90 days of the end of a fiscal year an annual report. And so this was approved last night at our Board of Health meeting, and so wanted to make sure you guys were able to have a copy of it. Just want to highlight quickly some of the amazing work of our health department staff. You'll see there are some maroon red pages that highlight our COVID response for 2021, and including, I think, one of my favorite pages, which begins on, I believe it's page 5 and goes through to page 7, and that is our volunteers that we had as part of our vaccination clinic. You may actually recognize some names in here as well, so many of you volunteered as part of that. But we had over 230 volunteers as part of our vaccination program. They gave up over 8,000 hours towards this response and the work. And based on their skill set, whether they were nurses, pharmacists, dentists, physicians, lay individuals, our emergency management and preparedness program was able to actually allocate out what that cost was. And they gave over $280,000 worth of time towards that vaccine. We could not meet the numbers that we listed in terms of the number of vaccinations given and the people served if it wasn't for our volunteers. So again, we just really wanted to appreciate our great unsung heroes of our response. And then continuing after the red pages, while COVID did take up a large portion of our work, we still continue to do services as needed, including some of the highlights, which would include a Legionnaire outbreak investigation, some awards that our staff received, as well as our EMA taking on the role of the city EMA as well, so really consolidating all emergency management into one singular program. We also had already been one of just over 300 counties or entities to be a nationally accredited health department. We actually went through reaccreditation last year because why not? We didn't have anything else to do during that past year. As well as highlighting the Complete Streets pop-up that was just outside the courthouse, as well as our WIC program and our dental program. So again, we're very proud of the work that we do at the health department, and this is just made as a reference document to just show you kind of a quick summary of what 2021 and our accomplishments are. In addition, last county board meeting, you read a proclamation, thank you, Board Member Duncan, regarding National Public Health Week, and I just want to reiterate that actually starts on April 4th, and it goes on through April 10th. And during that time period, we will be highlighting specific issues each day related to National Public Health Week. It's not only a time to support your local health departments and the work they do, but talk about public health at a broader aspect and how it's really connected to how we can create that thriving community that we want here in Peoria County. more than happy to answer any questions.
Bill?
Monica, on this report, and I like you, of course, doing this report. I noticed that we were 56% in regards to vaccination. I just wondered how we stack up. Do you have an idea what some of the other counties were percentage-wise, like those that border us, Tazewell and Fulton and Knox and on around and so forth? How do we stack up against the other counties?
Sure. The 56% of Peoria County residents that were fully vaccinated was as of December 31st of 2021. So again, what we did in that fiscal year. We're actually over 60% now, closer to 64%. Overall, we've always been slightly higher than Tazewell County and Woodford County. I would say we were all very close this time last year when vaccinations were just rolling out. But as the pandemic has progressed and vaccination campaigns have progressed, we started seeing some delineation. Overall, Peoria County is in the top 25% of counties in terms of vaccination rates. We see a higher value in Cook and some of the collar counties, and then similarly Champaign area, and then Springfield.
We also hear about Dr. Fauci asking people to, of course, continue to wear masks and so forth, but this next vaccination, how soon do you see it coming to our region, and how are you going to handle it?
So the question regarding, what's the next type of vaccines that we're seeing? So I think there's two parts coming through. One, of course, is still we are waiting for the under 5 population and that process to go through. We have a lot of families that continually ask when it's time for they can bring their younger children to get their vaccines. Likewise, we are looking at the new variant that is there, as well as the possibility of a 4th booster for a very specific population, those that are at the highest risk, either based on the type of living situation they're in, if it's a congregate living situation, as well as their age and any kind of other risk issues or comorbidities, as we term them. So we are watching that. If that does roll through, we expect more guidance of that in the summer time period and then into the fall. As with all of our vaccinations, we focus on data and the approval process through the Centers for Disease Control and Prevention, or CDC's ACIP model, Advisory Council. Once ACIP provides the guidelines on how a vaccine is able to be used and kind of the parameters of how you deliver that, usually during this process, we would always see the FDA would approve it, and we would get almost immediately the next day a pre-order form for vaccines. And then once ACIP approved it, it was already in shipment on arriving the next day at the health department. So once the kind of process starts, it's really quick. And the turnaround time for when those approvals happen and our standing orders are updated, we can usually get vaccines or those changes up and running within 24 hours.
Thank you.
Any other comments, questions? Jennifer?
Looking at this annual report, it's, I think, just a prime time to thank you and all the staff at the health department for the amazing work you've done, not just in 2021, but obviously continue to do. The challenges just never go away, and you guys keep pushing through, and it's always incredible to see kind of a report like this that summarizes not just the focus on COVID, but everything that you guys somehow managed to keep doing through all of it. So thank you.
Yes,
Appreciate
most
that.
certainly. Anyone else?
Monica, if you'll leave that stack with Jan or myself, we'll make sure the other county board members get it in their weekly packet.
Yep.
Okay, thank you. Okay, next we will, is anyone here for the Care and Treatment Board? No, they do not have an update. No report for them. All right. And how about the EMA, Jason Marks?
Good afternoon.
Good afternoon.
So you should see in the report I submitted, actually, our COVID-19, if you've been participating or you've remembered this over the last year and a half or 2 years, that the COVID-19 bullet points are becoming less and less each month as we begin to pivot or demobilize in the EMA's world. And I anticipate, in just looking at this, that next month it'll even be smaller, because I know a couple of these meetings we've already had discussions and we've we've canceled them or we're moving forward. So, and then I noticed in my meeting attendance, I left out 2 dates on the Peoria Healthcare Preparedness Coalition and the Mapleton Community Advisory Panel. Those are just 2 community meetings that I participate in on a routine basis. It just is very planning based. So we did some training. Exercise I did want to highlight what I found most interesting over the last month is that I was, the EMA or myself, we were selected to participate in a weather test bed with the University of Oklahoma on they're calling it a Brief Vulnerability Overview Tool, or the BVOT. We love acronyms in EMA. But the cool thing about this tool is that it works with the National Weather Service in identifying vulnerable populations, vulnerable areas within our community. That the goal eventually, again, this is in the very preliminary stages, but counties will then submit that information to their weather service office, and so then as the weather service office evaluates and forecasts inclement, particularly severe weather, they've got an idea of some vulnerable locations. So we've actually, this interested me so much, I initiated some discussion with our GIS folks, and so I work pretty closely with Josh and GIS on a lot of different maps for EMA, and we've already initiated some work on identifying that so that we can use it at the local EMA at our local level when we do have our weather spotters out, until it's going to be a little while before I think the Weather Service and the federal government's ready to roll this out. So, but that was a really interesting, it says a tabletop exercise, but it was a week long. We participated in a number of different things. So I thought that was important. We continue to maintain outdoor warning sirens, as we've talked about. We're waiting on some equipment for one siren, and then the others, it seems like at least every week or every other week there's a siren that pops up on our polling that you'll see on this. That this is the second time we've had an electrical weatherhead get pulled out. So we had to send weather crew or electrical crew out and do some work. So, and then finally, on the miscellaneous, I was just going to point out a couple other special projects that the EMA is working on. We've been selected to participate in a FEMA resource typing project. So that resource typing project, what we're doing is creating a standard for individuals to meet, so that then should they wish to be on a team or a local community needs a pod supervisor for a medical countermeasure dispensing or a pharmacist. And the goal with FEMA's typing is so that an individual, if a community in a faraway state, I don't know, pick one, New Mexico or Arizona, needs somebody to fill this role, there's a standard, and so we're developing that standard. Then additionally, we've been selected to participate in the Public Health Emergency Preparedness Evolution Project, which is basically the Public Health Emergency Preparedness Grant is the funding that the health department's received for 20 plus years, I think, as long as I've been doing this, and periodically they look at the grant and the project to identify is it meeting the needs and demands of the local communities. And so I've been fortunate to be selected to participate in that to help kind of guide what public health preparedness should look like in the future. So if there's any questions for me, I'll take them now.
Questions, comments? Okay, Jennifer.
Can you just remind everyone, as you usually do, in terms of the sirens and the equipment issues, that it's not that they're not functioning?
Oh, yeah. Yeah, so I think Jennifer's question is related to our outdoor warning sirens. So just a quick overview regarding them. I think there's 82 in the county. I can't remember the exact number. And here very shortly, and probably in the next week or two, they'll begin polling every night. Throughout the winter, we move the polling down to 3 days a week, simply because we've got a number of, they have battery backup, but then we have a number of sirens that have solar panels. And so in order just to maintain the life of the siren during what we consider less severe weather season. So we'll start back on a weekly, every evening. They'll run the test, and then we get a polling each morning, and we review the polling. And then if we see a siren has not pulled back, says, hey, I'm 100% working, functioning properly, we'll test the siren remotely from where we're at, and then if that doesn't work, Reagan goes out. Typically what happens, to Jennifer's question, is siren might have 8 speakers. 7 of the speakers are working, 1 speaker isn't. Well, the siren's telling me, hey, don't work 100%. And so what we do is we evaluate and we try to, if we got parts, we repair. Batteries get replaced immediately when they're down. But typically on speakers, what we'll do is sometimes we'll wait until we get a number of sirens that need repaired, and then we'll repair a number of them at one time simply because it's a little more cost effective for us with the manpower, basically. But just because the siren, so I think just because the siren says it may show up on this list does not mean we don't have coverage in that area. That's the other thing Monica and I have been doing is looking at where we've got dual coverage, 2 sirens over one area. So
Jason, I do have a question.
yes, ma'am.
Anyone else? Is there a schedule for touring your facility at this time, or?
Whenever it's really just somebody, you just contact me and we'll find a time to
Okay,
meet out there.
yeah.
Yeah.
I'll check with some of the others and see if they're interested.
That's the
Many of you
easiest
probably
thing.
have already toured, but I have not, and I don't know who else hasn't.
Yeah, you can either contact me directly through, email or
right,
Monica,
sure.
obviously I'm with, and we're happy to schedule a time for somebody to come out there.
Okay,
Best thing is to schedule a time just because it's not manned 24/7, so.
great. Okay, well, thank you. Any more comments, questions? Thank you,
Thank you,
Jason.
have a great day.
Okay, you too. Okay. Regional Office of Education, Ms. Kreider.
Hey everyone, good afternoon.
Afternoon.
Just a few updates from education. First of all, believe it or not, with the weather today, we are less than a month away from the kickoff of the GMB Arts and Education Spring Celebration. April 11th is International Jazz Day. You can join us at the Peoria Riverfront Museum, where middle school jazz bands will be getting a master's class from Mary Jo Papich. You can also join us on April 20th for Peace Day. I'll have more information about that. We'll be getting a press release to you, Gretchen, so we can publicize that. It is a variety of bands coming together to play peaceful music and speak towards some of the violence that they see. And so this was organized by high school bands. And so you'll see that coming to the spring celebration this year. So great to have them back and in person. I want you to know that, yay, finally our GED classes are back in the jail. But because of some of our difficulties with COVID, we've expanded. We were allowed to be more flexible with the grant. So we have a class going in the community classroom at, I'm sorry, but I still call it the old Kroger on Wisconsin. So over by Heartland Health, we have a classroom going on there, and we are providing some sanitation classes for that permit at the new kitchen at the Dream Center. And we're always looking for those kind of partnerships, because any kind of license or certificate that you can get just makes you more employable. Speaking of employment, I am partners with Arnitria Shaw at ICC, and her and I host the Emerging Workforce Alliance under the Regional Workforce Alliance, and we are hosting a summer seminar. We're doing that in June. We're going to dig deeper into internships, apprenticeships. We've kind of been tucked away for 2 years because of COVID. So how do we get our kids back out there? If that was one thing I could change about high schools, is why do we lock them away for 4 years and tell them we're preparing them for real life, but we lock them away in this building and tell them when they can go to the bathroom?
Yeah.
I'll never understand that. So anyway, trying to get them out and in our communities. So we're hosting that this summer, and ICC is going to be showcasing all of the things that they're doing, and we have another school coming to share how they do the college and career readiness indicators. So pushing hard for that.
That's right.
Right now, I hate to even say this out loud, but I will. We are written into the new budget for an expansion. We're written into the current budget through the legislature for an expansion of dollars to support truancy, and we need them. Trudy, whose office is downstairs, has never seen the likes of what we're experiencing this year. We've got a lot more law enforcement involvement with families, a lot more of before it even gets to court. So we have a lot of ideas about that should that get passed, and I will bring those to you once that's official. Professional learning, we're doing it all this summer. If that new money comes down, we're revamping the way we provide professional learning. Substitute teachers are unicorns. They don't exist. So since we can't get teachers out of the building, we need to have on-demand, ready-to-go professional learning for teachers. And so we're going to start building out on a Canvas platform. So we're realigning our services to what our actual needs are of our educators. So that new strategic plan and alignment, I think if George hears me say strategic plan one more time, he's kind of grumpy about that. But he knows we need it. We need a new alignment of how we're providing services, because it's never going back to normal. and I refuse to embrace the word new normal. We need to completely revolutionize the way we've been delivering education, not just to our kids, but to our teachers. And last but not least, I don't know if I can say this without emotion. The Young Minds Project, I am just thrilled at what the county board did, what we're all going to do together at the old Headington Oaks facility. I have been honored to be a part of that with Mike Eunice. Just before it was even an idea to put it at that location, we were talking about working on a capital campaign together. One of his organization is going to come present to my superintendents on April 8th because we're going to put together some kind of start the messaging, because when you do something like this, one thing it does is reduce stigma. So if you can start promoting that to children and to families, I'm very, very excited about what this will do for our students. I had a very emotional mom come up to me, and in the worst moment of her family's life, her son had to be sent to Rockford, and because there was no room for them in the inn, and that really, really impacted me. So I was very excited about that. And we have some other ideas, but those we're going to keep brewing. Because if you don't know, I provide the teacher on that floor at Methodist. And so, keep calling it Methodist, at Unity Point. So I was born a Methodist. It's now Unity Point. So we provide the teacher. So how could we now develop that and expand that? And what could that look like?
Yeah.
And how could we partner with the Peoria Regional Learning Center, our high school, as a step down or an expansion if you're not ready to go back to the big school like Richwoods. So we've got a lot of ideas around that.
Great. Any comments, questions? Oh, it's so exciting. Looking forward to that.
I didn't even say the C word. I didn't even say COVID. We're talking about new things. Very exciting.
Thank you, Ms. Crichton. Okay. Sustainability and resource conservation. Yeah, thank you. There she is.
Good afternoon.
Good afternoon.
I just have a few highlights from the information included in your packet. There is an electronics collection scheduled for Chillicothe residents on May 7th. We're still working out a couple of the logistics with that, but working with Kusakowski and then some staff from Chillicothe. The Household Hazardous Waste event is May 14th, which is very quickly approaching. And I just want to say that we are looking for volunteers. There are 3 separate shifts or whenever anyone is available to work. Happy to have that. And we are opening registration on April 4th, which is a Monday. And that will be open to 800 participants. Could be more than that if they carpool or combine things into one car. And then there was just an introductory meeting for townships hosted by Limestone Township, looking at combining, getting a better base level of service, waste service for a few of the unincorporated areas. So just introductory meeting there, held this month. And at the end of the information that I provided was utility usage. It continues to decline. The building that I pulled out to highlight was the jail, and they have a 9.6% reduction of electrical usage 2021 over 2020. And a lot of that can be attributed to some air handling and controls, but also lighting upgrades that have occurred over the last year.
Great.
And that's what I have, unless you have any additional questions.
Any comments, questions?
I have 2 questions.
Miss Linda.
All right, the first one is, how will constituents sign up for the Household Hazardous Waste event on May 14th?
2 ways. It is already up on the website. The link is up on the website, but it won't open until the 4th. Still working on the registration software a little bit and IEPA to make sure that they will have enough staff here to do the 800 residents or 800 cars that we're planning for. So they can sign up online at any time at their convenience, or they can call 9 to 1 Monday through Friday, and we'll register them. Last year we didn't have very many calls. Almost everyone was able to register online. We saw a huge increase in ability to use the technology between 2019 and last fall.
Okay, great. Linda, you had a second question?
Yes. Who will collect the fees for township refuse and recycling collection?
Should it move forward, it would be, it would have to be worked out with the treasurer's office. They do know about it, and we're part of this meeting as well.
The county treasurer, you mean?
Correct.
All right, so the county treasurer then would collect the fees for all the townships that want to participate.
Correct.
Okay, thank you.
Sure. Thank you.
Mm-hmm. Thank you. Any other comments, questions? Okay, thank you. And that would have been landfill. Okay, we'll move on to our joint resolution. Okay, and I need to get a motion, a first and a second. Miss Eden. And a second. Thank you, Steve. And we'll have Miss Monica. She'll do the presentation.
Thank you. In front of you is a resolution for budget amendments for both expenses and revenues related to the Health Department's COVID-19 response. This includes a total of 4 grants, 2 of which are continuation grants from 2021, as well as 2 additional grants for response work and COVID crisis work. What you see before you to kind of help break down it in the different backgrounds is based on the timing of how, and I do believe we discussed this in this committee when we were working through budgets, the budget cycle, we did know that these grants were going to be either extended or we get issued new ones to help us support the work as well as we move into this transition period. And so the Illinois Department of Public Health, through direct federal allocations, were able to provide either continuity of funds for specifically our outbreak investigation, contact tracing work related to COVID-19, as well as any further vaccination clinics, whether they are for pediatric or for our supporting possible booster vaccinations as well. And then the 2 new grants is partly to extend COVID response to finish out the year. So our original contact tracing grant that actually began in 2020, was a mixed funding stream from the state. We had to use 50% by a certain date, and then the remainder of 50% took us to 2021 and then into 2022. That one ends actually in March. And then we have our COVID response grant that takes us and completes that rest of the calendar year for us. Mm-hmm. Likewise, the crisis grant is actually a 1.5-year grant, and this is primarily focused on rebuilding public health capacity. Mm-hmm. So what you'll see is again related to either staffing, staff training, contractual for staff training, as well as any type of retention possibilities. We are losing a lot of staff. We're not alone. We've lost 2 nurses in the past month alone, and that is actually 40% of my nursing staff. So part of it is making sure that we're able to reinvest back into our workforce after such 2 years of kind of being on high alert or anxiety, bringing them back and kind of making sure that they are re-engaged in public health, as well as supporting a lot of the trainings that might have been either postponed or waived to bring them back into kind of that compliance and understanding. So more than happy to answer any questions.
Any questions, comments? Rob?
Just clarification, the performance incentive pay, that's done during their evaluations, correct?
Yes, and this is actually a line item. We are using this as part of the retention allowable costs for the crisis grant for the 1.5 years. We don't have a retention line item, so working through the budget, our director of finance with the finance team felt that this would be the most appropriate line to put that towards. But this is going to be, again, towards a retention. And also to note, these health department grants, especially these grants, are all reimbursable grants, meaning that if we don't use that expense, we don't receive that revenue.
Okay. Any other questions, comments? Okay. So at this time, we need to get a vote, is that right? For first and second votes? We already did that. Oh, we did it at the beginning, okay. That was for that. All those in favor now? Aye. Aye.
Aye.
And Rachel? Rachel?
Aye.
Okay, thank you. Okay, it has been motion carried. Thank you, Ms. Monica. Are there any miscellaneous? Rob?
Thank you. I just wanted to report that I attended my first triad meeting, which was exciting.
Yeah.
They're very excited to have a board representative on there. We are represented as a county with Amy from the Sheriff's Department, and she expressed her gratitude also that the board is involved now. I believe we more than doubled their budget with our little gift that we gave them, so they're very excited. They've got some new members on that they're hoping to breathe some new life into the organization, so
Wonderful.
Very exciting.
Wonderful. Exciting, yeah. Thank you. Anyone else? Okay. If there's none other, this meeting has been adjourned. 12:30.